Good afternoon. And Shariki, thank you for the kind introduction. You've been a real friend and partner for the Robert Wood Johnson Foundation, and I'm honored to have the opportunity to follow your clear and moving President's speech. You know, the message that you delivered clearly demonstrates that this is the time, and you and your message are the one that we have been waiting for. You know, it's good to be back in Chicago. I was born at a hospital that's no longer there, just a couple of blocks over there at Michael Reese Hospital. My parents were poor, so my mother timed her delivery so that she would arrive at the door in such a condition that she could not be transferred halfway across the town to Cook County Hospital. And just a few miles south of here at the University of Chicago, I trained in emergency medicine in one of the first residency programs in the country in what was then a new specialty. It was there that I learned that there was more to improving health than treating the injured and healing the sick. I can remember the night. It was late one night when a 16-year-old young man came in with a single gunshot wound right here to his chest. Our team of physicians and nurses were well trained for tragedies like this, and we went to work because as soon as he was brought in and put on the resuscitation cart, he stopped breathing and his heart stopped. Our team had learned by working together with teamwork, with each person on the team working to the full extent of their education and training, that if we did this, this was crucial to saving a life. It was my job to pick up a scalpel, to open his chest, to reach inside and remove a blood clot from around his heart. And his heart started beating. And he started to move. He was whisked away to surgery, and they replaced a hole in his heart about that big. They fixed it up, and he was able to walk out of the hospital. I went to visit him a few days after we had resuscitated him, and he congratulated me on my expertise. And he said that it was good that I was so good at my skill because I'd get more practice when the person who had put him in there was going to be shot in retaliation. It was then that I realized the limitations of patching up the injured one at a time, and that a different type of collective action would be needed to fix the health problems of our society. Reflecting on that experience, I changed careers, and I studied public health at the University of Illinois, again, not too far from here. And it was just a mile that way, in a very poor community called Grand Boulevard, as a public health practitioner, that I learned a little bit more about the fact that public health working alone could not solve our health challenges in this country. That's when the people living in that community taught us as our public health team about the importance of the social determinants of health and working with departments of economics and transportation if we were truly going to reduce infant mortality. Now, I know many of you have had similar kinds of revelations throughout your careers. That's why you're here. It was these kinds of experiences that led us at the Robert Wood Johnson Foundation to adopt a new vision, that we as a nation will strive together to build a culture of health, enabling all in our diverse society to lead healthy lives now and for generations to come, where being healthy and staying healthy is an esteemed social value. And if I hit the right button, my slide will actually appear. Thank you. In other words, making health a shared value, where individuals, businesses, and governments work collectively to foster healthy communities and lifestyles, fostering cross-sector collaboration to improve well-being, where who we are, where our parents come from, or where we live do not determine how healthy we are or how long we live, creating healthier and more equitable communities. And where health services and systems, including healthcare, are integrated to achieve value for our investments in public health, population, and healthcare by strengthening integration of health services and systems. These 4 areas form the major building blocks of the action framework. And you'll hear more about this in a presentation later on this week by Alonzo Plow as he talks about the Culture of Health Action Framework. And you can explore it on our website, which is being launched today here at this meeting, that talks about the role of this action framework and the role of everyone in working together to build a healthier, to build a culture of health. We recognize that these values and the adoption of them, that building on the resources at the community level and changing culture will take time. It will take as long as a generation. But if we are successful working together, we will have created the healthiest nation in that generation. Today, I've come home to Chicago, to Illinois, where I learned what public health is all about, and to the American Public Health Association, where our mission and your mission, our vision and your vision are aligned so closely. And with all the talent in this room and the committed people in the American Public Health Association and the power and the history of the public health movement, I know that we will be successful and build a culture of health, enabling all in our diverse society to lead healthy lives now and for generations to come. And thus, Generation Health will lead the way for us to be the healthiest nation. Thank you.